What's your name?
Fabola, Dr. Fabola,
And you are a...
family physician.
Are there any specific special tasks that you do in your job?
Treat patients, diagnose diseases, and treat patients.
What personal attributes will help you work well in your job?
Oh, you just have to have, you have to be very, what do you mean by the attributes? What do you mean?
Like your skills, special skills.
What are these special skills? Oh, okay. Yeah, you really have to have gone through medical schools. In Canada, you have to have the first degree in sciences and then another 3 or 4 years in medical schools. Then for family medicine, 2 years in family, for specialization in family medicine.
There are a lot of tools and technology you use. What type of tools do you use on the job?
Stethoscope.
And what is that used for?
That's to listen to the chest. Also, some cardiac test to check for any murmurs, any heart murmurs, any abnormalities in the chest.
What about a thermoscope? What do you use that for?
The thermoscope is used to check inside the eyes. And also we have the otoscope to check in the ears.
And then what's the oximeter?
The oximeter is used to check for the pulse of the patient and the oxygen level of the patients.
Inside of this pharmacy clinical, where do you usually work or where do you usually stay?
Basically, patient's room. For community and family physician, a lot of the time, since like when you came in today, you can see the moment I start, most of the time I'm in the patient's room. I only come to my room maybe to document or to do other things like phone calls from the hospital about a patient or from other doctors, or at times to check the new recommendation for something that is new that I may not have been aware of. Like you can see, one of the things on my desk today is the recommendation for the COVID-19, the coronavirus. What's going on is the flu. The flu is still very common in this part of the world, but you have to be well updated about the new virus that is going through the world now and knowing the recommendation from the public health what to do when a patient just calls or come into the clinic unannounced.
How many hours do you usually work a week?
Most of the time 40 hours, but sometimes it could be more than that because I start the day starts at 10 in this clinic because we have advanced access booking. So the MOA, the medical office assistants, calls the patient in first thing in the morning. So the patients actually they are trained to call their family doctor when they need their family doctor, so they are not pre-booked.
What would you say your favorite part of the job is?
In family medicine, for me, is the patient care, the doctor's-patient interaction. As you can witness in the room, the doctor's-patient interaction is the most important part of the job. When your patients are comfortable with you, they are able to tell you what's going through their life. They are able to tell you exactly how they're feeling, and you yourself as the provider, the physician, you putting yourself in the shoe of the patient. A lot of the time.
How long have you been working in this job?
25 years.
Would you say with that years of experience you have gained more knowledge?
Every day is actually. One amazing thing about family medicine is you learn every day. You learn a lot of things from your patient. What's amazing is actually learning from the patients themselves.
Did you want to be a doctor? Did you know that you wanted to be a doctor when you were my age?
How old are you now?
I'm 13.
You're 13? No, I actually didn't want to be a doctor. Oh my goodness.
What did you want to be?
I remember I wanted to, one time I wanted to be computer scientist at that age. Then at the time I wanted to do pharmacy. And then I remember I got into the university and I'm like, what would I do now? Just let me do science. Then I can think about what I wanted to do. The holder of the health system. So it's encompassing the patient care, acute, chronic care, prevention of the diseases. And at the same time, in the end of life, also palliative care. And also supporting the family and the patient in the end of life. And of course, in mental health that we have.
And what would you give someone that's coming into this working field?
What did you say?
What advice would you give someone working in this career?
That you're about to? Or you're thinking that you want to be a family physician?
Yeah, someone that wants to become
a family physician. The most important thing is to be academically sound. I would say that the important aspect of medicine is to be academically sound, because it really takes you to really give everything into studying. You, as a physician, one of the skills you need is to be able to solve problems. Because you are a detective, you're looking, people comes to you with a problem and you have to be able to solve it. So problem solving skill is the most important thing that you really have to have if you want to be a physician. And of course you need to be very hardworking and be a little smart. Being smart is one of the medicine that you gotta be, because to be able to solve other people's problem, I would always think that to solve other people's problem, you really have to be very smart.
How do you calculate your pay? Is it bi-weekly, yearly, weekly, monthly?
How do I get my pay?
How do you calculate your pay?
It depends on the healthcare system that you have. In Canada, most of the healthcare system are actually being managed by each province. So in Ontario, we have the Ontario